In the realm of complex chronic illness, talking about mitochondrial health is incredibly important. Mitochondrial health is important for all of us, whether we have complex chronic illness or not, but especially in the realm of complex chronic illness. And that's largely because virtually all of the pathophysiology that folks with complex chronic illness are dealing, or chronic complex illness are dealing with, ultimately can be traced back in some way, shape, or form to the mitochondria. So having ways to assess the mitochondrial health of a patient is really, really valuable. The challenge is that while there are tests that are available to assess mitochondrial health, none of them are 100% comprehensive. They all, for the vast majority of patients, at least that I work with, they are associated with a cost to have them run. In Canada, private insurance companies very rarely cover the cost. Even in the US, patients I work with there, insurance doesn't always cover these tests. They're oftentimes, between a few hundred to several $100s to run them. So, expensive, not 100% comprehensive. So it definitely leaves a fair bit to be desired in the realm of being able to accurately, reliably, and affordably assess mitochondrial health and function. So one of the ways of assessing mitochondrial health, which doesn't involve using a laboratory test, but is more of a functional test of the mitochondria, is seeing how a patient responds to working with comprehensive mitochondrial support. Now, as per usual, nothing that I'm saying should be construed as medical advice. Please talk to your personal healthcare provider about any therapeutic treatments or interventions that you might pursue prior to working with them. But what I do in my practice, and I've posted a number of videos about this, is I work with comprehensive mitochondrial support. So working with a couple of supplements that between the two of them give the patient virtually all of the cofactors and substrates that their mitochondria need in order to make energy. So in other words, for all intents and purposes, virtually every supplement that is crucially important for mitochondrial function is contained within these couple of formulas, and then I see how the patient makes out with that. And the vast majority of patients, when it's prescribed at the right time, they'll say, I feel more energy, I feel better, I have fewer symptoms. And oftentimes the improvement that we see is around energy levels or brain fog being lower than optimal energy in the brain. If a patient goes on the comprehensive mitochondrial support and doesn't feel better, then in my mind and in my experience, that for all intents and purposes is a functional diagnostic test to tell us that there's something that's interfering with the proper function of the mitochondria. So even though going on that mitochondrial support protocol is a treatment, if depending on how the patient responds to that treatment, in my opinion and in my experience, it gives me some good insight into what's happening with the patient's mitochondria. They go on the mitochondrial support, they start feeling like $1,000,000. That I can extrapolate from that and assume that there aren't a whole bunch of barriers standing in the way of their mitochondria functioning properly. On the other hand, they go on that formula and they don't feel much better, or they don't feel any better at all. It begs the question, well, why is it that we can't supercharge those mitochondria to start cranking out more cellular energy, known as ATP? So while one could argue it's a crude test, it's not, it doesn't involve blood samples, urine samples, things like that, measuring exact numbers of things. Functionally, it's been a very reliable test. And to give an example of that, when I've had patients who have not had much of a response or any response to the mitochondrial support, and then we go ahead and do additional exploratory testing to see if there's something like heavy metals or mold illness or chronic infections or something like that affecting their system, we find one or more of those issues in virtually all of those cases. And in many cases, when we address those underlying root cause issues and then the patient goes back on the mitochondrial support, the second time around, they'll see, oh, it does help. And that gives me a clue that, oh, the mitochondria are not under as much duress as they were previously before we got rid of those underlying root causes. So it's been very helpful in my clinical practice, and I wanted to share that with you today. If you have any questions or comments about this, please feel free to post in the comment section below. If you aren't already following me on Instagram, or if you haven't subscribed to my YouTube channel, please consider doing so. I post content as often as I can during the week, and furthermore, if you haven't joined my newsletter, please consider doing that. I post links to all of my videos in those weekly newsletters, and then I also talk about some of the fun and exciting things that are happening in my clinical practice, and also make announcements about things like live Q&A sessions and different initiatives that I have going on outside of these videos. So I will leave it there for now, and thanks for watching.